before us, but I don't know where to begin. But I don't know where to begin. Again, I lost my strength completely. Oh, be near me, tired old mare with the wind in your hair. Amethyst and flowers on the table. Is it real or a fable? Well, I suppose a friend is a friend, and we all know how this will end. Chimney swift that finds me, be my keeper. Silhouette of a cedar. What is that song you sing for the dead? What is that song you sing for the dead? I see the signal searchlight strike me in the window of my room. Well, I got nothing to prove. Well, I got nothing to prove. I forgive you, mother, I can hear you, and I long to be near you, but every road leads to an end. Yes, every road leads to an end. Your apparition passes through me in the willows and 5 red hens. You'll never see us again. You'll never see us again.
Hello, hello. Yes, these webinars are recorded. I don't know why it's doing this weird background thing for me. Who knows why? We'll start in just a minute. How about you put in the chat what your very first job was, other than babysitting? I'll put my very first, oh, lifeguard, I like that. You can come off, if you're comfortable with it, you can turn your video on. I like seeing people, but you don't have to. Hey, nice to see you. Everyone in meeting. Lifeguard, kitchen porter. What is a porter? Like a server carrier of things?
It's like a person that washes up in the kitchen.
Gotcha. That's not nearly, well, I don't know. How was that?
Busy.
Are you a great washer now?
I'd like to think so, but probably not.
Have you heard of I think it's the Zen of washing dishes. There's the Zen of motorcycle maintenance or something like that, but I think there's also a Zen of washing dishes. What is a newspaper shop? I think I remember those. A newspaper shop. I used to go when I was a little kid to, I think it was a newspaper shop, and they sold cigars. And they had all these beautiful old cigar boxes that I would go in and the owner would give me, and then I'd put all my treasures and baseball cards in there. Maybe that's what a shop is. My very first job was making waffle cones at an ice cream shop. And this was back in the day where you had to form the waffle cones by hand. They didn't have any, now they have these dowels, and people don't know what it was like when I was a kid, and you formed them and you had to pinch the bottom so the ice cream wouldn't melt and fall out. And you did that with your hands, and you had to do it very quickly. And it was very hot. And now I don't feel pain with these three fingers, which my daughters think is my superpower, which is to be able to touch very hot things without feeling pain. You can put your superpower, if you learned a superpower from that first job or the worst job you've ever had, that might have been mine. That would be good to hear. Also, and we'll get. No, this is good. Can you all hear me? Give me a thumbs up. Cool. All right. So welcome to the webinar. I assume I imagine that people are going to be joining in as as what happens in the world. And so we'll just kind of continue on. I only have kind of exactly an hour, but that doesn't mean that we can't follow up afterwards with questions by email or Zoom or whatever is most helpful to you. People typically do have a lot of questions. I am recording this session, so I'll send out that recording a little bit afterwards. And that, I think, is that. Well, welcome you all. Ooh, farmhands. I could just do this first job thing for the whole hour. I know you all probably want to learn something different though. Let me go ahead and share the screen, but I just wanted to introduce myself. I'm Daniel Weinshanker. I'm one of the facilitators and program directors at StoryCenter. And I've been with StoryCenter since pretty much 1999, which is when I took my very first workshop. And most of the people that work at StoryCenter or work with us started as students and kind of fell in love with some aspect of it. I hope you fall in love with it too, if you haven't already. I always like to start with a story. And how many of you actually, you can just, I guess, give a thumbs up or actually just put it in the chat. How many of you know what digital storytelling is already? You can put yes or no. Yeah. Okay, so most people, but for the couple of people that, yeah, for the couple of people that don't, we'll explain kind of what we kind of break it down into process and product. A lot of people, when thinking about digital stories, they think about just the product, the story that's made, but we actually are really focused on the process. However, in public health, oftentimes the product becomes super important because there are ideas, by our clients about using the story for very specific purposes after the process happens, after the workshops. So we'll kind of talk about that a little bit more as well. So I'm going to go ahead. I always like to just share a story to start us off. And I'm going to share a story that's actually made by someone who works in a public health field. So a lot of the public health work I'm going to show will have to do with, this woman kind of straddles two lines. We're all involved in public health. Some people work in public health as well. She's going to talk about both things happening at the same time. And so we can kind of take a look at that. The rest of the stories that we're going to see are not going to be people that necessarily have a job in public health other than being activist citizens, rather people affected by something going on in the country or the world having to do with public health and health of their community. So we'll see some of those. But this one kind of spans two parts of this. And as with all of our work, if you know our work, I don't need to tell you this, but it always bears repeating that a lot of people choose in our workshops to talk about very difficult things. Sometimes that is trauma with a little t, sometimes that's trauma with a big T. And so with any type of content like this, I just urge people to take care of themselves. And if you want to step away from the computer, most of these stories are about 4 minutes, and you can come back. And so let me go ahead and grab this story, and we will give it a watch. Can you all see this barn? All right, cool. Hopefully the audio works as well. This is 3 minutes long.
I inherited this work. My grandmother, mother, sister, and now me. I avoided this work. I didn't want it, a heavy weight to carry, and I cry far too easily. I inherited this work, love and strength, pain and trauma. I wonder what we inherit from our families. Wonder what we carry and what we can choose to put down. Last week, after a court, a mom texted me, "What's tribal customary adoption? Will I still get to see my son?" When this mom was a child herself, my mother tried to help her parents. Generation after generation, the pattern continues. Parents, familiar and unfamiliar, bare themselves before us to get their children back. My heart feels for them. My own daughter is too. She is a regular old daredevil, chatty Cathy, pushing limits, learning boundaries, sometimes testing mine. And yet, I would do anything, change anything, be anything to protect her. I think most parents would, and yet some don't. Some won't. Some can't put down their pain, their addiction. Some only when their chance is passed. Some never show up. Their children never learn their faces. I wonder what these kids will inherit. I wonder who they'll choose to be. Working in this job has taught me that my daughter will inherit things from me, and I want them to be the good things, the love, the culture, the kindness life has to offer, all the great things I inherited from my mother, and she from hers. Motherhood has become my mission to be the best I can for her, to show up every day for her. And in my job, I try my best to help other parents show up for their kids in the ways they deserve. And if they can't, to find them safe homes, safe guardians to love them. Pray they'll inherit something good instead.
Okay. Any thoughts about that? Responses? You can put them in the chat if you want. Sometimes just a breath is good. Colleen, I think you raised your hand. Go ahead.
Yeah, I was just gonna say, she never really told us what she did, but I think we all know exactly what it is that she does, right? So I kind of liked how it was subtle in sort of the message, but yet very clear.
Yeah, thanks. She's a social worker. I'm actually also a social worker. I didn't mention that, but part of that, I actually went back to get that degree to help serve the communities. I just wanted more tools in my tool belt to help serve the communities that we often interact with. And that's important. Yeah, and sometimes we do these workshops just for process only with people who work in public health to make stories like that about why they do the work they do, how the work affects their life outside of work, if there is a boundary there. Sometimes there's not, and vice versa. I do a lot of work with nurses, actually public health nurses, where we tackle those kinds of narratives for their own kind of battling compassion fatigue, and also vicarious trauma that they carry along with them. So I think you can kind of see that story straddling both, and maybe you're thinking about your own work in public health and what brought you to this work and what you take from this work as well. What's dangerous about this work, rewarding about the work that you do. All right, I'm going to go back to the PowerPoint, which I don't really love so much, but I know people sometimes like to see things there written out a bit more. Hopefully you can all see that. And you can see me hovering, I guess, on a black field. I'm not really quite sure why, but there it is. Keep changing stuff with Zoom. I was going to show this story. Again, another story by a public health worker about the effects that COVID had on them while trying to do their work, and kind of very specific things that were going on during COVID for people in public health. Who, this woman, for example, is pulled out of her work in HIV and infectious disease to do COVID work. And here in Colorado, we saw, I think it was our first vertical transmission of HIV to a baby who passed away during COVID. In part because we stopped HIV testing in the city to focus on COVID, and so that kind of thing where you're in one way, she was dealing with the abandonment of the community she was serving to serve a different part of the community, and how hard that was for her. And the Department of Public Health here in the state did that whole workshop just to help the people working in the state public health department deal with what they were going through at the time and afterwards. I'm going to keep going. Some of our agenda for today, we're going to try and get through everything, but a lot of this stuff is also on our website. So I just encourage you to go to the public health section of our website. There are tons of case studies on there with example digital stories that were made from each case study. I'll just do a very quick background on StoryCenter, and then how and why these stories and this process. Again, I want to break it down to process and product. So I just gave you an example of how the process was useful, in terms of processing what goes on in our work and how we survive in that. Looks like there's something in the chat too. Oh, you see the presenter view? Well, I don't really know why. All right, maybe I can stop that end show, and I'll just do the regular view. Okay. should work a little bit better. Oh, sorry. Yeah, so we'll see some of those projects, some of the process and outcomes, and then if we have time, we'll do some Q&A. So just a little bit about kind of where this whole methodology came from. We actually started as a small theater in San Francisco. Our founder was involved in a lot of social justice work. His parents met at a pecan sheller strike and were both activists in the south of Texas, mostly for migrant farm workers. So he opened this theater and it was mostly dedicated to activist stories on stage. One of the performers came through and wanted to use video as part of his show. And so they cobbled together all these like little 3-minute videos about his life that he would narrate live on stage. I don't know how old you are, how vintage you are, but my parents used to do slideshows and narrate them as well. And this was something like that, except it also had video in it, not just still pictures and sometimes music. And people loved this. So, and it was kind of rough looking, someone's own personal pictures. And people were like, I have stuff like that. I want to do that. And right at that time in 1993, the very first video editing software became available on a personal computer. And they kind of saw that this was going to be something people were going to be able to make video for kind of the very first time. And that was even before the web, before even the idea of publishing our own video became available. But that was to come shortly thereafter, obviously. But the very first digital storytelling workshop was run in 1993 by the guy that did this theater project and also the founder of the theater, Joe Lambert. And after that very first workshop, they shut down the theater within a month and opened up what was called the San Francisco Digital Media Center. But it was focused on not just teaching people literacy in terms of the skills of making video, but one of the things that they did as a mandate to this that goes back to the social justice aspect of this work was that agency is incredibly important, and especially to communities and people that never had a chance before to tell their own story, edit their own story in screen media, and then publish it, of course, later. And so the kind of one of the only rules we have in the work that we do is that we ask people to tell first-person stories, true stories from their lives. So, or at least what felt true at the time. Lots of people come back to their stories later and like, I have a completely different take on that now. And that says something about our stories and how we live with them and how maybe they're living organisms. I like to view them that way. They change every single day. The story you tell about how your parents parented you, if you tell it when you're 20 versus when you tell it when you're 40 and have your own kids maybe or something like that, totally changes, right? So from that time, 1993 until now, we've been running these workshops. Some of them actually look exactly the same as they did back then. We also, of course, now teach a lot online, which we didn't back then, but we still do love having the in-person workshops where people come together, and I'll kind of show you this. Like I said, first-person stories. They are also almost exclusively done in group processes. We find that the bringing together of people helps people to understand their own stories better. And in kind of deeper ways, as people interact with each other in the workshops, ask each other questions, they hear the stories that other people are telling that then reminds us of a story or a different view of our own story that we hadn't considered before. And that really is something that I don't think is covered a lot in our process, which is that even though people usually come to one of these workshops with a very clear idea of the story they're going to tell, maybe most of the people do, they end up telling a completely different story. And the story that they end up telling is new. It's a story they don't know. And you can take this with you out of this webinar, which is, what does it mean to tell a story that you don't know? And I think that's one of the things that's really at the heart of why this process is so impactful for people. And then oftentimes maybe why the story is then so impactful for viewers, including the person who made it. We work with all different kinds of communities at all different levels of literacy, both written literacy, storytelling literacy. So many people come into the workshops and say, I'm not a storyteller. And we're like, yeah, of course you are, because we kind of all are. That's how humans often communicate. And then also tech literacy. So we work with lots of groups that, maybe, gosh, we've even done work out off the grid in Uganda with women living in small villages with obstetric fistula, and the stigma of what that is like to live with that condition in a community that has a lot of stigma against women living with those people that have never used a computer before. So we have ways of scaling the work to different kinds of literacy and language. This last point, community needs, language issues, project goals, all of those kinds of things go into these projects that we run with clients. And client could be a state public health department, another nonprofit, an NGO, sometimes even corporations, often not, but sometimes foundation work. I like this little quote from some folks that run their own digital storytelling program called Patient Voices, who we trained up. Oftentimes systems, really large entities, like to run these workshops to glean and gather stories of the quote unquote end users of a program, or research, or patients, to see what the system is like for them to go through. This is just a little, that's my dad with a giant zucchini from actually the garden that he planted the day after I was born. And that's one of the zucchinis he grew. The reason I'm putting this in here is just, there's a little story that I sometimes tell, and I'll try and tell it quickly, about the use of stories in public health and around human behavior, which is that, and maybe my guess is that you could talk about this in a far more eloquent way than even I could. So I'm preaching to the choir here, but my father smoked. He's also a scientist and chemist, PhD, worked in a Nobel lab, a really intelligent guy who smoked and knew that smoking caused cancer way before they ever came out with it, with the notice from the Surgeon General. And he quit the day before the Surgeon General announced that smoking caused cancer. And I asked him why, and he said, because I didn't want people thinking that I was just following someone else's orders. I like that story. When you think about, like, when we've done, smoking, anti-smoking campaigns, or the effects of smoking on kids, for example, and one of the things that, again, that we talk about in public health, and maybe you talk about it too, is that statistics don't typically change behavior. Stories do. So, pamphlet that says smoking causes cancer isn't going to do a whole lot for you. Nancy Reagan saying just say no isn't going to stop people from doing drugs. But I don't know if you saw some of these. I think there was the National Cancer Association has these video ads of people who are dying from lung cancer and smoking through oftentimes their Trey Coles, talking about what it's like to have cancer and to have been a lifelong smoker. Those kinds of messaging often have a much greater effect on the public, on viewers, than statistics do, or mandates. I'm just going to show one of these stories. This is from a workshop we did with the Louisiana Bucket Brigade. And it's called The Women of Cancer Alley. This is to source stories about the conditions that families were living in Cancer Alley, which is this certain part of Louisiana, as you'll see, where a lot of stuff was going on that was affecting the public. And this was one of them. Let me go over to my browser, and I think it's this one right here. So this is an example of not working with people necessarily as public health professionals, but working with people affected by things in the environment, in their environments and communities that have an effect on their health.
One night, my 3-year-old daughter asked me, "Mommy, why does it smell so bad?" It was overwhelming, like something was burning. I was scared my sinuses would be inflamed and my daughter would get sick. I prayed and went to sleep, but sleep didn't come easy. I feared we might not wake up in the morning. 5 generations of my family have lived in the St. James Welcome community. It used to be so vibrant. During the 1960s, my grandfather helped integrate the parish public schools. Going through the struggles of segregation and fighting for voting rights, he welcomed the development of a fertilizer plant in the 5th District. He believed it would create job opportunities for young blacks, a good salary, employer-paid health insurance, and pension plans. My great-grandparents, Velmont and Clara Reed Calvey, had passed down 40 acres of land. My parents built our home on the family land in the 1980s and took pride in it. My siblings and I spent hours playing outside and exploring the field. I wanted that for my daughter. Instead, we've had to worry about what's being pumped into the river, soil, and air. When I was in college, my whole family got really bad skin rashes. Doctors could not figure out how to get rid of them. We ended up having to put bleach on our skin to kill the rash. It was very painful, but it was the only thing that worked. Then, in 2016, my mom was diagnosed with autoimmune hepatitis. I suffer from debilitating sinus infections and often have to miss work. For years, we didn't know why we were getting sick. Now we do. If my grandfather were still living, he would stand up and fight with us against the pollution. Shouldn't everyone want a world where all the kids grow up with their basic human rights, like clean air and water?
Just gonna stare there. Any thoughts about that one? Seriously, feel free to just come off mute and ask questions or interrupt me. I love that. I love kind of as much interaction in these webinars as possible, but I know that you all want some information from me. But anything about that video or that project? That wasn't actually a project that I worked on, but I don't know what's of them.
I think it's kind of interesting, just your point about statistics and stories. I was recently putting together a lecture and was actually talking about like environmental sacrifice zones and came across Cancer Alley and had read a bunch of statistics, but it wasn't until I watched it. It was a little bit of a longer video, but it actually like was the community story that I
Yeah.
like, it clicked in my brain, like how awful it was.
Yeah, it's not. I mean, yeah, Statistics can make a really big impact on this kind of large level, but when we take a look in, I guess, in public health about what actually changes behavior, it's not going to be that. I'm actually currently working on a project right now with, actually, the PI lives right down the street from me. He's a pediatrician at Denver Health, and he's studying vaccine hesitancy in communities of color that are mostly patients at his clinic, at the Denver Health Clinic in the neighborhood. And so again, he really struggles even with his own patients to try and have them understand the value and the importance of vaccines. In this case, this was even before COVID that he started this project. It was mostly around the influenza vaccine, or flu shot, which they don't really like to call it. And so he's working with the community and a group that's already, they're caregivers who had some hesitancy around vaccines for very good reasons. If you know anything about the treatment of communities of color with the pharmaceutical and medical industry, is pretty horrific. So some really good reasons why there's hesitancy, but he actually told me this story the other day. So he put out part of this project was that his clinic, the Denver Health Clinic, sends out text messages to all the patients that come to that clinic saying, okay, it's September and it's time for the flu shot. So he was testing those regular messages, text messages, against messages that say, Ellie, some messaging about the story. Ellie had never had a flu shot before until last year. See what got her over the hump to get her daughter vaccinated. And so he's testing people, watching those and seeing if those have a different impact on people as to whether or not they come in and get vaccines. And so he's waiting for the data to come in, but he said, actually, the other day in clinic, I had this family that was, very skeptical of the flu shot. And he's like, well, hold on a second. I want to show you a story. And again, you can make your own decision. It's just, here's one, someone that really reminds me of you and some of your hesitancy and what some of the things they went through to get to where they ended up, and showed them a story. And they're like, yeah, well, that really changes my mind about this, and went ahead with getting the vaccine. I'm sure you all have stories of the impact of stories in the work that you do. Hopefully you do. Let me just answer the question here. How important is production value in creating these videos? Narrative-driven videos, examples beautifully edited and put together. That's interesting. I mean, I'm glad that you find them beautiful. I do too. A lot of people who are used to professionally produced and edited videos don't find these beautiful in the same way. And that's exactly why we do the work. Because these feel like they're made by people like us. It's like a baby walking for the first time. So you'll see, as I'll explain hopefully in a second, really quickly, that people make these videos themselves. I said that before, or a little bit about them telling their own stories, but as much as possible, we want people to have as much agency in the process as possible, because that's actually life-changing for them. When I work with sexual assault survivors, for example, on campaigns to reduce stigma around sexual assault, the process itself, often, this is their words, not mine, the process itself is often part of their healing. And for those of you who work in trauma environments, know that maybe one of the things that's important about trauma is a lack of control. And so this process is all about giving control to the storyteller and agency on their part. So sometimes the story that you choose to tell about a traumatic experience is the first time they've you felt any control at all over that narrative in your life. So these workshops, again, like people might have an idea of what they're going to do. That changes a lot. They end up doing something, saying things that they'd never said before, that they never known before. So that process itself having an impact even on the people in the workshop, let alone the people that are going to be watching the story afterwards. So I'm wondering how feasible it is to use this technique in health research without filmmakers on board. That's exactly what we do. And the roughness of these pieces, the roughness of watching a baby walk for the first time is exactly what makes these pieces maybe a bit more trustable than highly polished, professionally produced media. That's not what these are supposed to be. It's not what they are. And I think actually the acceptance of this kind of screen media is just going up and up and up, because we're seeing more and more media produced or made by people that are not professional media makers. I mean, just look on TikTok. What we expect out of screen media these days is very different from what we expected 30 years ago. Very different. So this actually becomes, in some respects, more trustable than mainstream media. People turn off when they see they're being sold something with stock imagery and stock footage and things like that. Some people do, of course, like some documentarians do absolutely wonderful work with communities that may not have the opportunity to do something like this. And I value that work, and I also value this work concurrently. So I hope that that low production value, and I would say that the stories themselves are not low production. Like the narrative that people are telling, we spend a lot of time with people on how to craft the narrative, which what I mean by that is, and I shouldn't say it this way, but the voiceover, the story that they're telling with their voice, their written words that then becomes their voice. And then we spend a lot of time talking with them about the use of visuals, the use of sound, all those other things. And true, that is all part of the narrative as well. This video seemed less about changing behavior and more about changing conditions. Sure. Yeah, some of these projects are about advocacy around changing conditions. Anyone that wanted to make such a video but stay anonymous all the time. And so we have ways of making the stories anonymous, and that changes all the time with all the weird technology that's coming out with voice recognition and whatever. So sometimes people have someone do their voiceover for them. Sometimes they never have their name on the piece. Sometimes they never have pictures of themselves in their stories. They use only artwork. Sometimes we have illustrators make the stories. If I have time, I'll show one of those. Yeah, so there are lots of times when people are anonymous. Let me go back to the PowerPoint and see what else I can share. So, oops. So what we get people to, and most people come in wanting to write essays, because it's kind of starts as a written process first. Our written language and the way that we tell stories with our written word, that's when people say, I'm not a storyteller, I don't write stories. That might be true. We're not often asked to write stories in the work that we do. If you are, awesome, then you have a job that I'd love to have. But oftentimes we're writing reports professionally, or PowerPoints like this, or who knows what. But yeah, people feel oftentimes like really inadequate as written story writers. However, we are, and so they, instead of writing a story at first, they write an essay. Cancer Alley is an awful place. For years, they've been blah, 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 blah. And it goes on and on, like a expository essay, instead of, I remember the time that I ... So the themes are always universal, like people wondering if their story that's very personal and unique is going to affect a wide swath of people. And our argument is that yes, that actually, your own personal details is actually what engages large swaths of people as opposed to the other way around. We look at stories that create intimacy, convey a sense of honesty, that avoid very specific messaging. They tell a story, you get your messaging out of the story. That's what the word engagement means to me and to, I think, to us. When you say, oh, it's an engaging story, what's engaging about it, or what does engagement means? It means that the viewer, the audience actually has a job, and their job is to pull the message out of the story. Often when the failure of the stories that we try and tell is that we overtell them. And in that moment, I realized that ... We want our audience to come to those realizations on their own as much as possible, because that is engagement. It gives them a job to do. Make meaning. So that's often what we talk with people about. It's what makes it, what helps to make these stories short rather than long. Oftentimes the stories are long because there's a huge introduction to what the story is going to be about and what it's going to do, and then a conclusion. And I'm doing it right now. I'm overtelling this whole meaning. And that conclusion is, and here's what you're supposed to take from this, and here's the mandate. No, that's not what we do. You can always have information around where the story is published. Say it's on a web page. You then can have contextual information that goes with the story. Here's a discussion guide. Here's what you can do about this. Here's ... all the things. I think I saw a hand go up. Let me see. Are you all starting to leverage or encourage folks to leverage social media formats, editing tools, and yeah, well, that's part of our growth. Actually, like all these stories you're seeing are horizontal, and part of our growth is now starting to shift to, where are people viewing these stories? How are they viewing them more often than not? Are they viewing them on TVs or even on laptops, or are they seeing them on their phones where they're used to holding them this way? So great question. Yeah. Powerful about not hammering home, the take-home message. Good. I'm glad you found that powerful. I find it super powerful as well. And that's part of how I guide storytellers in our workshop. So on that note, oops, let me go back. So we go through some of these things called the 7 steps of digital storytelling. And it's like, what's your story in the bigger story? Like what something from your own life experience that you bring to it. Hearing your story is the script writing and the recording of your own voice. Seeing of the story is getting people to think really mindfully about what it means to have a narrative that's visual, and how does that visual narrative, quote unquote, this is really important, go with, what does that mean? Go with the voiceover or the words. And you see kind of, I would say, a struggle, or I don't like to say failure, but a struggle with this in PowerPoint and how people use PowerPoint. I say the word PowerPoint to you and ask you what your emotion is around that word. Most people say, I hate it. Well, why? That's like hating a hammer. A hammer's just a tool. PowerPoint's just a tool. It's how we use it that sometimes is not super effective. And the way that we use it is sometimes the way that I'm using it right now. But I think I'm actually doing something hopefully a little bit better, which is that I'm not just repeating everything that's on the slide. So the human brain, especially our human brains now, and the type of complex narratives that we process all day long, we're smarter than that. So showing a picture of the exact thing that you're talking about all the time is not what is super effective for most people. So thinking about the composition, how important each of these elements are in making one of these digital stories, is something that we focus on. And the default is, for most people, like 90% of people, is, I'm talking about cancer, I need to show a picture of cancer. Or I'm talking about the doctor's office, I need to show a picture of the doctor's office. there are other options. This is just a little note as that harkens back, harkens back. I don't know where that came from. Harkens back to what I was saying at the beginning around process and product. So this is what happens in the workshop, typically, whether it's online or in person. We have a discussion about the form and aesthetics. And that includes these 7 steps. We watch stories, talk about them, kind of exactly what we're doing now. We have a group story circle where people share their ideas for their story and get feedback if they want it. It's self-directed feedback. It's not like a Shark Tank. It's hopefully we spend a lot of time hopefully crafting and curating very safe and brave spaces for people to feel comfortable sharing their stories, and not just sharing their stories, but exploring their own stories, exploring their own lives. Train people on how to record their voice. They think about imagery. We teach everybody, in most cases, video editing software. And they put the pieces together, sometimes with a lot of our help, sometimes with not much of our help. And then at the end, we have a group screening. That's the workshop itself. When it comes to working in campaigns, then there's a whole nother part of this, which is then what happens to those stories after. I'm going to kind of go through this. But these are all kind of some of the things that we think about. Why people use digital storytelling, and it starts just with this creativity and personal voice. So sometimes people just make the stories, like I said, people like the public health nurses that I work with, they're sometimes they may just be making the story for themselves. That's it. It doesn't go anywhere. They take it home with them. It's just the process. And then it moves on from there to different kinds of campaigns, advocacy, policy changes, research evaluation. I think this is pretty self-explanatory. I think that's the other thing I usually talk with a lot of clients about, is how that group process is super important. Like in the project I'm doing right now around vaccine hesitancy, this group of caregivers that have all overcome some kinds of hesitancy around vaccines to engage with them have now formed a group, a community group that they talk with each other. They go out into community together. They know each other. They're more likely to help each other show up for things. And the PI of the grant, Josh Williams, he's so ethical about the work that he does in listening to community and having them actually shape the research. He's held meetings from the very beginning with this group, with this community group, and has them help to shape what the process is going to be, how the stories are going to be shared, what types of imagery do they think works best with these stories and with their community, and how it resonates with them, the type of messaging that's going to go around the stories. They decide everything. He's so wonderful to work with in terms of his respect for the community that he's working with. I'm going to skip over this just because we have a lot to go, but these are just examples of the many projects that we do. Again, I'm going to point you to, I'm going to come off here and share this screen. So this link, this will be in the email, but you also can just go to our website and under custom services, look at case studies. And this one are all the case studies. And these are just a smattering. We've helped, we've helped people create more than 100,000 of these digital stories and trained countless people in doing this work themselves. It's in pretty much every country in the world. You could Google the country in digital storytelling and you'd find a project somewhere. this is the work that I have done with public health nurses with Nurse Family Partnership, who are all home health nurses working with first-time mothers living with significant health risks, whether it's poverty, domestic violence in the home, all the things that go with poverty, often intersections with all kinds of risk factors. But you can take a look through all of these. There's just a million of them. Here's just some. We work with students in public health to help them process why they want to do the work they want to do, helps to crystallize what they're going to go out and why they're involved in public health at all. We've done this work at Columbia. We've done this work at the Fielding School of Public Health at UCLA. Here's the PRC, which I've done some presentations for over the years. Here's the Illinois Mental Health Digital Storytelling Project, maternal mental health, sorry. I'm working on one of these for Michigan Public Health Institute right now around maternal mental health. I've also done safe sleep initiatives from people who have lost their infants. This is actually the paper or the study that I just talked about around vaccine hesitancy funded by the NIH. So there's just a million, not a million, but a lot. We do a lot of work with the Hepatitis B Foundation. Conversations about hereditary breast and ovarian cancer and how important those family conversations are. This was a CDC project called Bring Your Brave. This is an example right here. There are some examples down below. These are all the providers. The providers, physicians, genetic counselors, didn't have time to go through the whole process themselves. So this was an example of where we did kind of a hybrid process where they participated in sharing their story, the written story, the oral story, then the written, and then helped them record their voices. They gave us the voiceovers. We worked with community artists from the community, whether sometimes we work with refugee artists and pay them to come up with visuals to go with these stories. Sometimes we work with art students at a local high school or college. And so we have these really cool collaborations that sometimes work out right. And so they created all the visuals for these pieces. And so it kind of reduced the ask, I guess. It is a very intense process, and for people that go through the whole process, you're asking them for a lot of their time. And sometimes that's a barrier to recruitment for a workshop like this. We also encourage people to be stipended, especially if it's a research project. That's part of our ethical practice. Another thing, and we have this whole ethics section that's really important to us. You can look up ethics on our website. But one of the things that's really important about doing this work, and we will not do this work with any client that will not agree to this aspect of the work, is that storytellers always own their stories. They're never owned by an organization, never owned by a school, a foundation, nothing. They might use them with consent, and we also view consent as an ongoing process, not a one-time thing. There's a lot of that also that has to do, though, with transparency with people in the process about what consent really means in this day and age when you put a video out there and then a year later you decide, oh, I don't want it out there, and you take it back. That doesn't necessarily mean that it's gone. So talking with people before that fact, before even or during that process of recruitment is super important that people know when sharing personal stories. It might change the story that they tell, the details that they put in. the types of imagery they use, etc. And so if they know what's going to be done with the story, chances are greater that they're going to be making something that you can quote unquote use, that they feel comfortable with sharing. Okay, I think I'm going to stop there. I could show a million more stories, and I love showing them for sure. But you can go to any of these pages and watch stories from those projects. Type of work with high school aged youth. Yes, all the time. I just did a research project out of the University of Cincinnati around HPV and Asian teenagers. It's very specific, but their thoughts about HPV and risk behavior. So, yeah, we do that all the time. Was that more difficult due to parental consent? Yeah. So we go through a parental consent form as well. That was through it was through a university, not the high school. But I have done this work with high schoolers as well around high school activists, early activists in high school, and doing an intergenerational project with activists in the community here. They all told stories about a time when they stood up for somebody or something, or a time when they didn't but wished they had. And so we had elder activists and youth come together and share stories around that. And the youth then wrote and performed a play from the elder activist stories and presented it back to them. Super cool. Not using writing as part of the process. Yeah, we've done that as well, where you just interview people. It's just a very difficult thing to do because people don't often tell very concise 3-minute stories. So then you spend a lot of time editing. And if you listen to StoryCorps on NPR every Friday, that's what they do too. People have 45-minute conversations. Professional editors take that audio and whittle it down to 3 minutes. The part about that that's very difficult, again, for us is it takes agency away from storytellers. So sometimes we'll have them edit the audio with us or sitting next to us, and they get to decide, because you can pull any story you want from 45 minutes of audio. You can make people sound awful or evil or whatever. Okay, thank you for the space. You're welcome. If you need to get in touch with me, you probably all got an email from me, but it's Daniel@StoryCenter.org. I'm sorry we didn't have time for question and answers, but please shoot me emails, and I'm happy to talk with you about the projects you're thinking about doing. And I also really encourage anyone interested in this just to sign up for one of our public actual workshops, a digital storytelling workshop, whether it's in person or online. If you're thinking about doing this work at all, or working with us, going through the process yourself, I think, is invaluable. Then you'll know what the process is, how you might need to change it for the community that you work with, what you might keep, what you might need to alter, all those things. Plus, it's like super fun. It might change your life. It changed mine. So I'll leave you with that, and thank you for your time. Hope you go have an incredibly reflective day. And I will stop the recording now. Record now.